All right, I see we have some folks starting to join here. We'll get started in just 1 more minute or so. All right, everyone, I think we'll go ahead and get started here while people still trickle into the room. And as always, we will make a recording of this webinar available after the fact so that you can watch and distribute it to your networks. But just want to thank everybody for joining Virginia Clinicians for Climate Action's Health in Our Changing Climate webinar series. We started these during the pandemic and have continued them quarterly this year, and are very excited today to welcome some guests. But to introduce them, I'm going to turn it over to Dr. Samantha Adut in just a second. But just a couple of quick housekeeping items. One is that all attendees are in listen-only mode. We will have some time for questions at the end, and at any point during the webinar, you should feel free to enter your question in the Q&A box, not the chat, if you can remember to keep it in that one, but the Q&A in your Zoom menu will give all the panelists access to those questions, and we will get to them at the end of today's presentation. But with that, I'll turn it over to Dr. Adut to introduce our speakers today.
Well, thanks everyone for joining us today. We're very fortunate to be hearing from Drs. Gould and Dr. Gentili about the EPA's wonderful new report, Climate Change Impacts on Children's Health and Well-Being in the Contiguous United States. I'll tell you a little bit about our speakers. Dr. Caitlin Gould is an environmental health scientist with the EPA's Climate Science and Impacts branch. She is also a very proud daughter of Central Virginia. Caitlin recently defended her doctorate in environmental health and engineering, and has a background in mixed methods research, occupational health, and marine biology. Dr. Gentili is a geographer and environmental social scientist with EPA's Office of Air and Radiation Climate Change Division, Climate Science and Impacts branch. Her research interests center on the interactions between humans and their environment, applying a spatial and social science lens to climate change impact analysis and climate change indicators. She also co-manages EPA's climate change website and leads climate adaptation efforts at the Office of Air and Radiation. So thank you. Well, thank you both so much for joining our group today, and I will pass it to you now, Dr. Gould.
Thank you very much, Dr. Adut. I am going to share my screen. While I do, I want to say thank you very much to all of y'all for having us today, for having me and Dr. Gentili on today. Thank you very much. And I have the wrong presentation up. Thank you very much to y'all for having us on. And my apologies. Computer, Dr. Gentili and I have had a lot of issues today with technology. So this has been, it's been a day with Teams. So thank y'all very much for your patience as well, because it's been a day with Teams. I'm gonna just, all right, swap that, and then share my screen. All righty. I think we're good until I switch this. Hold on. All righty, we're good. Can y'all see my screen? And it is the appropriate screen.
We can. Looks good.
Awesome. So thank you again very much for having us today. Thank you to Dr. Bagwell and Dr. Adut. We're really excited to be here. Like Dr. Adut said, I'm really biased. I'm from Midlothian, so, and my family are all clinicians of one form or fashion or another. So I'm really excited to be talking to y'all today about this. But Dr. Gentili and I are really excited to be presenting generally on this report, which was a real labor of love. Has been a real labor of love. You know, as Dr. Adut said, our report's called Climate Change in Children's Health and Wellbeing in the United States. It came out at the end of April, so just a little over a month ago. And I would be completely remiss if I didn't acknowledge Dr. Adut for her individual role in helping out with getting this report out. She was one of our peer reviewers, and she's also just been absolutely phenomenal with helping us to share this report, including to connect us with your group today. So thank you very much to Dr. Adut. So to give you a little bit of background about where this report is coming from and also who are we? So Lauren and I work in the Climate Science and Impacts branch in the Climate Change Division at EPA. CSIB, again, Climate Science and Impacts branch, is basically like a climate science think tank, we like to say, within our division and within the agency. Some of the main undertakings that our branch takes on include developing climate change indicators, running the climate change website for the agency, but also conducting analyses under a framework called the Climate Change Impacts and Risk Analysis Project, also known as CIRA. So we might refer to CIRA, C-I-R-A, a few times throughout the presentation today. And effectively what CIRA is it's a framework for quantifying, projecting, quantifying, and monetizing climate change impacts on different sectors out through the end of the century, looking at their impacts on the United States, both contiguous and the entire United States as a whole. So I'll talk through some of this in particular with regards to our report that we're discussing today and some of the analyses that we've done. But effectively what CIRA does is uses a common modeling framework that looks at a specific type of climate change stressor and then how it affects different types of impacts across sectors. So for example, you know, as we'll talk about today, looking at changes in infectious disease and how certain climate change variables such as temperature and precipitation are potentially affecting, for example, Lyme disease cases. So CIRA's methods and sectoral impacts have been published in over 50 individual journal articles and peer review journals, as well as in 3 prior and now 4 with the addition of this full-scale agency reports that look at a suite of sectors. And so you can see these here at the bottom, the 3 prior sectors or the 3 prior reports we've put out. We also have all of these available on our website as well as all of the journal articles. So to give you some sense more specifically about this report and kind of what was driving this as well as the scope of the report. So, you know, I don't need to tell y'all, you're all physicians or nurses, pharmacists, et cetera, PAs. You know, kids are so uniquely affected by changes in climate, you know, not just climate change, but changes in climate. But of course, as the climate is going to continue changing, as temperature change, air quality changes, you know, coastal flooding occurs, et cetera, we're likely to see more of these effects in aggregate and certainly exacerbated than they had been previously. So our report is kind of a response to that, to the acknowledgement that kids are uniquely vulnerable to different climatic conditions and changes, but certainly has been driven by the administration's repeated emphasis on climate change, environmental equity and environmental justice, and also children's health. So, you know, certainly the emphasis, this has just been a consistent drumbeat in this administration, and this report is certainly in response to that. And I would also likewise be remiss if I didn't mention that we produced this report in very close connection with EPA's Office of Children's Health Protection, in part in response to that. One of the other things is that there has never been, to the best of our knowledge, a national scale multi-sector report that looks at climate change risks and that quantifies these potential risks in the United States. So that was one thing that we've heard consistently over the last several years. We need something like this. So we're hoping that this fills a gap, and we hope that this, in turn provides y'all and your colleagues with a lot of information about just some of the ways in which kids could be affected, and in which children's health could be affected. This is not a comprehensive report. There are a lot of sectors that we don't look at. There are a lot of health outcomes, a lot of climatic inputs that we don't look at for one reason or another. But we do hope that this helps to shed some light on some ways in which kids are likely to be affected. Where possible, we look at overburdened populations. And so for the sake of, we are socially vulnerable populations. For the sake of this report, we define those as being children who are individually low income, identify as BIPOC, so Black, Indigenous, and people of color, children who do not have health insurance, and here we go again, Lauren, BIPOC, low income, children who don't have health insurance, children who are low income, BIPOC children,
limited English speaking,
and children who are limited English speaking or who come from limited English speaking households. Thank you.
I have a code word, language.
Yeah.
Language.
It's basketball season, right? Thank you for the assist, Dr. Gentili. I really appreciate that. So anyway, we look at children typically between the ages of 0 and 17, although in some instances we do take into account fetal health. And then we also, to the best extent possible, try and incorporate in potential adaptive responses and adaptation mechanisms, although this is not possible in all of our analyses. So the structure of our report, like I said, we look at a series of climate stressors and then conduct a series of detailed analyses under those. But to give you a sense of kind of how this report is structured, so we have 5 climate stressors that we look at: extreme heat, air quality, changing seasons, flooding, and infectious diseases. And the way we structured our report is each of these has its own individual chapter and then an associated technical appendix that provides more information on how we conducted our analyses. Within the chapters, we start out with a fairly rigorous literature review that covers more of the gamut of ways in which that individual stressor is linked to children's health effects, either through climate change or otherwise. And this leads into the detailed analysis where we look at, again, one specific area that we're anticipating will be affected via climate change out through the end of the century. So, so we provide a quantified projection of these changes through the end of the century. So for example, with extreme heat, we look at learning losses, air quality, we look at different health outcomes associated with exposures to changes in air quality, PM 2.5, ozone, and other types of particulate matter, and pollutants. We also look at, pollutants, I should say, I'm sorry, other types of PM, or things contributing to PM rather. Changing seasons, we look at aeroallergens and different health outcomes. Flooding, we look at effects on children's homes. And in that, I mean home loss as well as home displacement. And then with infectious diseases, we look at changes in Lyme disease risk across the Eastern United States and parts of the Midwest. And then at the end of each chapter, we call out these kind of emerging areas where we didn't have sufficient data to conduct a full-scale analysis, but where we thought there were sufficient data to provide some kind of back of the envelope calculations or initial calculations and assessments of areas that are likely to be emergent climate issues, but that presently have not been well documented and are certainly areas for further exploration. And so you can see these that are highlighted over in the right-hand column. And like I mentioned, where we do look at fetal health in particular is with regards to wildfire smoke on maternal and fetal health. So, so just to draw your attention to that as one additional area. And kind of along those lines too, West Nile, as I'm sure all of you are aware, doesn't typically impact children as severely as adults, but when it does, it can have really, really extreme effects on kids. And so we also felt that that health outcome and that stressor was especially important to highlight in our report. So I'm going to talk today about Lauren and I, or Dr. Gentili and I will talk today about 3 different areas of analysis. So Lyme disease, heat and learning, and coastal flooding. And we'll talk through just some of the results that we found through our analyses. But first, just to give you a sense of kind of the stepwise approach that we followed to conduct our quantitative analysis, which was consistent, at least insofar as the general framework and the general sense across all of our analyses. So we, for each one, established current vulnerability or vulnerabilities among children, including, different types of health outcomes associated with that particular stressor that we were looking at. We then project future environmental conditions, so climate change stressors, including, for example, changes in temperature, changes in precipitation, air quality, et cetera. And then based on those analyses, forecast future impacts on children linked with climate change. And again, our technical appendices go into more details on this, or I could provide you with more information during the Q&A, or one of us could. In the analyses that we talked through and in our results today, and in the core of the report, you'll see that we present our analyses looking at, or results rather, looking at 2 and 4 degrees centigrade changes in global average temperatures. So that's changes on top of basically contemporary temperatures or temperatures today. We do provide a broader range between 1 and 5 degrees of global warming in the technical appendix, or appendices rather, if you're interested in finding out more about that. So one of the areas, like I mentioned, that I wanted to talk about, or that we want to cover, is looking at changes in infectious disease risk and Lyme disease as an indicator of that change. So I should mention that the paper that this was expanding upon, Yang et al., is currently in review with EcoHealth, and hopefully we get it back soon. But I do just want to let you know, if you're looking for the underlying paper with this one, it still is in submission phase and in review. But basically, what this paper looked at was looking, or what this analysis rather, not what this paper looked at. So we identified the baseline number of new Lyme diagnoses across the country, and then within the 22 states. There were 22 states in the District of Columbia, including the District of Columbia, included within this analysis. And we looked at the baseline number of Lyme diagnoses as a whole, and then among children, and then calculated changes in the prevalence and range of Ixodes scapularis, which is the deer tick, more typically known as the deer tick, or the black-legged tick, here in the eastern U.S., which is the most common vector of Lyme disease in the U.S. And then we also looked at changes to the distribution of Borrelia burgdorferi, which is the bacteria that's responsible for Lyme disease. And then we related these to changes in future rainfall, temperature, and land cover patterns across the U.S. to find our analysis. And so, or at least within our area of interest. And so you can see here the states that we've identified as being the 5 states that are most likely to see the greatest increase in new Lyme diagnoses, just under 2 degrees centigrade. So I don't want to make it seem like these are areas that are not going to have greater rates of, or high numbers of Lyme. It's just, these are the areas where the rate of change is the most significant. And again, this is a more moderate warming scenario that we've included. 4 degrees, like I mentioned, is the more extreme scenario that we were looking at. And this is further highlighted on this slide, which shows the aggregate of what these cases are likely to, or could potentially encompass under 2 and 4 degrees centigrade. So you can see we're anticipating within, again, the 22 states in DC, we're anticipating at the moderate level of warming, still a pretty high number of new cases of Lyme annually, 2,600 cases annually on top of what is currently baseline. And I'll show you what baseline is on my next slide. Additionally, at 4 degrees, you can see that number is substantially higher. 23,000 new Lyme cases in kids. And I should mention, again, annual cases in kids between the ages of 0 and 17. So pretty substantial increase in Lyme disease incidence. And this is, I think, really highlighted on this slide where I show baseline. where you can see the areas, the regions of the country that we incorporate in. On top of, looking at the 22 states in DC and the sample, baseline is 8,600 cases per year already. So you can see that that's almost a 50% increase in cases under just a moderate level of warming across the entire region, that we're looking at. But when you look more specifically at regions, for example, with the Midwest, you can see that that we're anticipating an almost 100% increase in Lyme disease incidence. And what's significant about this is, when baseline's only it's still a lot, but only 1,700 kids a year or new cases a year at baseline, and you're adding on a substantial proportion to that, it makes it really hard to message because these are areas that may not presently be as aware of Lyme disease and acute and chronic risk and health outcomes associated with Lyme exposures. So certainly something to be aware of. And you can see how much more dramatic this is at the higher rates of warming, where even in areas that already have endemic Lyme, such as the Northeast, it still is almost a 200%, 150 to 200% increase in Lyme cases. And then in the Midwest, it's almost a 750% increase. So very, very significant. So I'm going to talk now about really quickly about changes to heat and learning and how we're anticipating that heat could potentially affect student learning and thus annual income rather per student across the United States. And so we conducted this analysis looking at the penetration of air conditioning in schools and in homes, and then looked at learning levels determined by quantifiable metrics, existing metrics such as the PSAT, which is nationwide, as I'm sure all of you who are on this call are very, very well aware. We then calculated the future average daily maximum temperature during the school year and then applied this to look at changes in temperature and how this related to changes in learning losses. So you can see here, what I think is one thing that I think is really interesting is, all of the states that we're expecting will have the greatest changes in learning, and lost future income are all in the north. And we get a lot of questions. Dr. Gould, why not in the Southwest? Why not in the Southeast? I would think that this would be huge in the Southwest, which is already super hot and getting hotter. And the thing is, these areas already have a lot of air conditioning. So the impacts are likely to be more significant in those areas, given that I'm sorry, just clicked, given that they don't have as great air conditioning penetration. So we're expecting that areas that are already hot might be getting hot and hotter and hotter and hotter, but they probably are already having, they probably already have some adaptation mechanisms in place with greater likelihood of having air conditioning. And this is really considerable because then you consider how this affects kids' income and their income as adults. So we're expecting under 2 degrees centigrade of warming, about a $1,300 per year annual lost income per child. And then which in aggregate amounts to about $6.9 billion across an entire cohort of graduating seniors. And that's an annual loss. And so that's a lot of money. Obviously, that's a lot of money, both individually per adult, but also for the country as a whole. And I think this is really interesting when you consider adaptation, where, so this is the lower level of warming, right? 2 degrees C, $6.9 billion in losses. We estimated that the annualized cost of installing and maintaining HVAC systems that would allow for air conditioning in US public schools comes out to about $4.2 billion. So substantially less than even the the losses at the lowest level of warming. That being said, we also determined that air conditioning school doesn't totally account for learning losses. Anyone who's ever tried to study for a test, let alone get a good night's sleep in a hot house or apartment can certainly attest to the fact that it's really hard to do that. It's really hard to sleep. It's really hard to study, let alone have control of your mental faculties and feel comfortable and psychologically prepared for a test or to do your homework or pay attention in school. So that's these losses are only partially erased with air conditioning in school, we certainly need to have air conditioning in homes as well. So I am now going to turn this over to Dr. Gentili, and thank you very much.
We're going to switch gears a little bit here and look at the results of our coastal flooding analysis. So this impact analysis looks at the risks to children through impacts on their homes, and that's from storm surge and sea level rise. And in particular, we're modeling the number of children likely to be either temporarily displaced from their homes or to lose their homes completely because of coastal flooding. So we're looking at sort of two endpoints, if you will. And as Caitlin had mentioned earlier, where possible, we do try to consider the effects of adaptations. So we do explicitly model both a with adaptation scenario as well as a no additional adaptive actions scenario. And those are exactly what you would anticipate being. The with adaptation are those protective measures that people might do, like building levees, seawalls, beach nourishment, elevating properties, things like that. And then the no additional adaptive actions is a little bit different. That one's assuming that the properties that we're looking at are maintaining their current level of protection, whatever that might be. So if we were to look at this graphic here, the temporary home displacement, you can see that that one affects significantly more children, over 1 million in both instances of sea level rise. And this one is usually reflecting of people leaving their homes, or children, I should say, for a short period of time, usually minor flooding that subsides, damage that might easily be fixed, so to speak. And then in contrast, the total home loss, you can see, does actually substantially increase from 50 centimeters to 100 centimeters and ends up being over 1 million children affected. And this one is the more catastrophic outcome. We are looking at, in this case, repeated and intense damage from storm surge, as well as permanent inundation due to sea level rise. It's a little bit different. And this set of results on this slide that we're showing you does reflect that no additional adaptation that I was talking about. And we do explain all of the results within the report. So if you're interested in looking at that in terms of both with adaptation and what those impacts look like versus this no additional adaptation, please explore that. But for the sake of time, we're going to just give you the sort of worst case set of results, if you will. And one thing to keep in mind with any of these results, adaptation is very complex. It's hard to anticipate. It requires significant capital up front and maintenance costs. So our results with adaptation or no additional are really bounding aspects, and the actual reduction risk is going to fall obviously somewhere between those two. Next slide, please. Wherever possible, we also do like to dive in and see which areas within the US might be experiencing some of the greatest impacts or higher rates. In this case, this shows the projected distribution of children affected by home loss at 100 centimeters, and again, a no additional adaptation set of results. And that area along the coast that's showing that darker shading are those areas with the higher rates of affected children in terms of the home loss. And you can see that the 5 states in particular with the highest rates are concentrated in that Southeast and Gulf Coast region. And what was really kind of interesting when we dove in trying to sort of understand the drivers behind these flooding impacts, we found that within that Southeast Gulf region, it's primarily due to storm surge, as you would expect, hurricanes, in other words. Whereas on the Pacific coast, in the parts of California in particular, it's actually primarily driven to actual inundation from sea level rise. Next slide, please. And wherever possible, as Caitlin had mentioned earlier, we do try to look at what we call the disproportionate impacts. In this case, for this particular analysis, it's the likelihood of disproportionate coastal flooding impacts on overburdened children. And if you look at this graph in particular, you can see that children from each of those 4 demographic groups that we focused on, limited English speaking, low income, BIPOC, and no health insurance, these particular groups are more likely to disproportionately experience temporary home displacement at 50 centimeters of sea level rise, so the top left graph, as well as total home loss at 100 centimeters of sea level rise, so the bottom right. Now, I do want to take a moment and just explain, you're going to see obviously this negative % or value or 0%. That does not mean that children in these areas are not going to experience impacts. It just means that they are not currently living in areas with the highest rates of coastal flooding. So it doesn't mean no impacts, they're just not disproportionately in an area that's experiencing the highest rates of it. And another thing to keep in mind is that the way our model works, that with each interval of sea level rise, that band of coastline being impacted by flooding is changing. And so the populations being exposed within that band of coastal area also changes. So that also reflects why you see differences between the 50 and 100 centimeters of sea level rise. Next slide, please. Okay, to transition, that was again just a subset of all of our results. We have significantly more in the report, so I really do encourage, if you haven't already, to explore that. And in the next slide, I will get into what we actually have on our website that you might be interested in. But just to take a moment, we do within the report identify our limitations of the analyses, as well as key research gaps, so areas of further inquiry. And this is just a sample that's on the slide here, but are certain ones that we wanted to highlight with you. The first is that our impact analyses were confined to the contiguous US. There are data limitations in terms of having appropriate downscaled data for other areas like Hawaii, Alaska, Puerto Rico, and the US territories. There's also American Community Survey limitations as well in terms of the spatial resolution that we can get at. That's consistent for our analyses. So it would be really great to be able to pursue that further. Those areas outside of the contiguous US, I should say, you know, they are on the forefront of a lot of the climate changes that are occurring and the impacts. And so to be able to look into that and account for that and the effects on children is really, really important. Another thing is that how climate change causes or exacerbates developmental and mental health effects in children. Our report and the SIRA project in general is a quantification approach. That is the method that we employ. That can be very challenging to have data on mental health effects of children or developmental. So another data limitation, unfortunately, but one that really would be significant, the coastal flooding I just gave an example of. Obviously, that's an area, is the mental distress that children, as well as adults, might face being displaced either temporarily or permanently from their homes and the disruptions that occur. So again, another area that would be really, really important to dive further into. A third is improving our forecasting relating to adaptation. This one's very tricky. It's obviously probably one of the hardest to anticipate, just given human behavior, but it's also really important. It's only one side of the picture. We can tell you the impacts, but we do know human behavior plays a significant role, and understanding how adaptation might occur, costs and benefits, long-term effectiveness is significant in terms of understanding how reduction in risks might occur. And then lastly, it would be great to also expand studies that look at compounding effects at the national scale and adjusting for different demographics. So obviously children will face multiple stressors at one time and impacts, and how those interact and cause cumulative effects on them is, again, just another area of research not accounted for within our study, but one we're well aware of and would be great to be able to pursue. Next slide. And then lastly, our report and materials. So within our website, you can access this using the QR code, but we have the report itself. We also provide summaries for parents and clinicians, as well as a separate executive summary. And then we also have appendices and data. So the methods that we have, as well as the data that we used, is available within here. Next slide. And that's it. So we're happy to take any questions you might have. I think some were getting addressed within the chat, or I should say the Q&A, but happy to have the conversation. So thank you all for listening and really appreciate your time.
Thank you
Yes.
so much. So Dr. Gentili and Dr. Gould, this has been excellent, and I think this really, you really whet our appetite, shall I say, for all the information in that report. There's so much great data in there for all of us.
Sam, your camera is a little bit off.
Oh yeah,
At
it
the
is.
top of your head there, but
There it is. I'm
there
in
you
my
are.
office today. It's a really wonky camera. Thank you. I see that we do have a question here from Leon Vinci. And that's if in the process of conducting this project, you collected anecdotes or any particular real life scenarios that you could share.
Yeah, I saw that. I guess, could you, Dr. Vinci, could you clarify, do you mean in terms of qualitative analyses or just general examples of general examples of how these effects could occur?
Oh, yeah, actually, the next level, I didn't know if while you were doing that research and analysis, you came across literature or other episodes where you saw, I mean, it reported already impacts from, from a sea level rise or intensive heat situation where, it was just a case in point, or any examples you might have heard about.
We didn't, not for this, which isn't to say, I mean, there are examples out there. There is a huge need for qualitative research. As as a mixed methods researcher, I would love to see more. So I guess we didn't do qualitative research. There is a new part of the Office of Research and Development at EPA that is going to be focusing on climate change, that is hiring a whole lot of social scientists. So hopefully they will explore this area in greater detail. There is a big need for more qualitative research in this area, let alone mixed methods, as well as, including survey information. So there are some reports out there, not a whole lot. I could try and point you in the right direction if you're interested in any that do get more at this, but they were not a factor in the analysis that we brought in. In this analysis, this was strictly quantitative.
We have a question from Dr. Paulson. How is EPA using this report in the administration's whole of government approach to climate change?
Dr. Gentili, you want to take that one, or?
Yeah, I mean, this particular report fits well within,
As Caitlin had mentioned, the administration's prioritization in terms of climate change, children's health, and environmental justice. So within that, obviously the report was intended to help support that messaging, provide information, quantified numbers, if you will, in terms of potential impacts that then could be used to help, I don't want to say justify, because that's not exactly the right word, but basically help recommend, these are the impacts in the future, some of which are already occurring now, and can help encourage further work and support additional measures that might help minimize impacts to children. It also does align really well with the Office of Children's Health Protection within EPA, and better links the climate aspect. So EPA's Children's Health Office, obviously, very much from a toxicology standpoint, climate is obviously a major area for them as well. And so this helps stand up more information, if you will, and bring those linkages together. So that I could say maybe from a whole EPA approach, Definitely this report helps bring together other offices that we otherwise typically may not work with or interact with. And how it gets used beyond EPA by other agencies and groups is not for me to say, but we hope it is, you know, valued and used well in other people's work.
We have a question about excellent. I'll just read the question. Excellent presentation. Is there a possibility of reviewing the title to include the word contiguous, to at least in part address the fact that there's historic and systemic exclusion of the U.S. territories on research, as you mentioned?
So we did talk about this actually in the report. You know, we're only covering part of it obviously right now. I do want to clarify, because we focus only on the lower 48. This is a concern we've heard multiple times at this point. You know, I guess to kind of get at your question, we're probably not going to change the title of the report at this stage of the game. To address the other components of it, which I do think are really important to respond to and to keep into consideration. You know, the short answer for us is that a lot of the federal data sets that we rely on only do climate impact modeling within the contiguous United States, and so do not unfortunately include Alaska, Hawaii, and the territories. Developing the base data ourselves is not a trivial task, nor is it an easy one, and is really outside of the wheelhouse of our branch and our division. So I do just want to clarify that this is not something that we did consciously. We really have tried very hard to incorporate in Alaska, Hawaii, and the territories. So I know this isn't necessarily a satisfying answer, because these areas often are omitted, but we are really trying hard to make progress. So, you know, we list this as the first priority research area for future work. We think that this is certainly the largest shortcoming in the report, the fact that these areas are not incorporated. And we've been trying to work hard with our federal partners, both within the EPA and at other agencies, to expand the data sets that they are developing in order to accommodate more than just the lower 48, and thus make it easier for us to bring this in. And then our branch is actually also looking at potentially bringing in a postdoc, hopefully next year, maybe a couple years out, that would look at analyses outside of the lower 48. So we are trying very hard to bring these in, to incorporate this into our analysis and into our work. So yeah, we're trying.
We have a question from Pam Tinker, who recently moved to Oregon from Virginia. I'm wondering if there is research regarding future wildfire issues in the eastern U.S., similar to what's becoming common on the West Coast. And I would actually maybe add a little, my own question to that, is the role of fire suppression policies in eastern forests, how that differs and may influence those wildfire events.
Yeah, Dr. Tinker or any of you, I'm happy to share. There are a couple papers that look at the eastern US, in particular wildfires around Florida, Arkansas, South Carolina, in Georgia, I think are a few offhand that I can think of. They are obviously, you know, not as prominent or preeminent, I think, in the public mindset because of the extent, duration of those that occur out west. But there are papers that do look at other regions of the country and how those affect and are affecting human health, not just children's health. I mean, I think one thing to add to that is, you know, so with our analysis, when we, in our air quality analysis, we look at, like I mentioned, we looked at PM 2.5, ozone, and then some other more specific conditions. And I guess those more specific conditions for us include the presence of aeroallergens, as well as wildfire smoke from the Western United States and dust in the Southwest US. And, you know, again, this is largely due to the number of wildfires that occur out west, or that do occur out west, and the extent of the data that are available. But I mean, at the end of the day, a lot of the smoke, contains a lot of the same contaminants. So, so not just, not just environmental matter that's being burned, but also metals, man-made materials, combustibles, et cetera.
I have a question with regard to air conditioning access and impacts of heat on learning. In addition to geographic variation in access, are there other socioeconomic issues that were brought out in your report in terms of access to air conditioning?
We were not able to look at that in this report. Unfortunately, those certainly are concerns. And, I know we had gotten a similar question which answered in the Q&A, but thank you for bringing that up. To the extent possible that we kind of incorporate this into our report. So, our analyses are based on existing data, again, the data that we have. And so we used 3 papers in this analysis, one of which, the one that provided the bulk of the data for our analysis, had proprietary data at the county level. So unfortunately, we weren't able to look at a more detailed or nuanced perspective of changes on air quality and presence of air quality within individual counties. So a lot of our analyses in this report are conducted at the census block group or tract level, but this one was only at the county level. That said, one of the other analyses that we used to do the actual economic determination used a phone call campaign. So that hopefully helped to address some of the inequities in distribution of air conditioning within homes in particular.
Any other questions from anyone in the audience? I think we answered all the questions in the Q&A. Excellent. I just want to mention myself, when I see the Lyme disease data, I'm aware as a practicing, clinician of the vast majority of Lyme cases are unreported, and so how those surely reflect a small percent of actual Lyme cases, right? Yeah. All right.
Yeah, that's a huge thing with the data that we use. We use CDC, what is national reportable, oh my gosh, national identifiable reportable data, right? But anyway, we use CDC data for that. And that's a huge thing. I mean, their estimate is something like only 15% of cases, I think between 5 and 15% of cases are actually identified. And unfortunately, that's the thing with, like I was saying, in the Midwest, I mean, you have areas of the US that don't currently have a lot of Lyme disease. It's just not a big thing. And as that changes, you're almost certainly to see more cases that go unreported or that are diagnosed way into disease progress, and so are likely to have way more severe sequelae than what, for example, here in Virginia or in New England, which is obviously becoming very well aware of the effects of Lyme disease, that they're more likely to see. I mean, and I think it speaks to a lot of communications and the need to improve communications and risk awareness, so that physicians and their partners, let alone parents and kids, are able to easily identify a Lyme case, especially given also the symptoms of early Lyme, not just a summer cold. So test for Lyme.
And we do have another question from Pam Tinker. It seems the great increase in AC will impact the amount of energy consumed, potentially causing increased pollution if it's that energy coming from fossil fuels. And is that discussed? Is that factored in?
You got it, Caitlin, or do you want me to?
Short answer,
is no.
tomato.
Short answer, no. We acknowledge, obviously, that energy consumption would go up with more AC usage, but that also, of course, yes, causes it's a qualitative discussion, but it is not quantified within our analysis how that would affect in terms of energy usage and future pollution. We don't actually quantify that. That's outside the scope. But we do acknowledge from a qualitative standpoint that that is a downside of AC usage, is the fact that it has environmental and economic implications.
And one thing to add to that is, even though within the scope of this report that doesn't fall within our scope, and we focus just on primary risks, such as, for example, effects to heat and learning, we do acknowledge that we could have reserved more space to talk about some elements of risk, for example, like what you brought up, Dr. Tinker. And in the future, we will certainly consider this among our priority research gaps, so that we can hopefully address this more readily in our future research.
Well, thank you so much, Drs. Gould and Gentili. John, is there anything we need to review for CME?
No, everyone who attended today should get a follow-up email tomorrow with instructions for how to claim CME credit through a new system that Innova has launched, which our accreditation is through. So keep an eye out for that, and we'll look forward to seeing you on the next webinar. Thanks again to our speakers.
Thanks so much for having us.
Thank you so much. Bye-bye.